Hello and welcome to this National Pathology Week video. My name is Dr. Susie Lishman and I'm President of the Association of Clinical Pathologists. This series of videos on pathology myths and misconceptions was recorded as part of National Pathology Week 2024, an annual celebration of the vital role that pathology plays in everyone's healthcare. It was developed by the Pathology Alliance, an umbrella organisation of all of the UK's pathology societies and organisations. In this video, Dr. Matthew Clarke will explore the statement, "Pathology is all about dead bodies."
Good evening, everybody. Delighted to see so many of you with us tonight. As Susie said, my name is Matt, and I work as a diagnostic neuropathology trainee, and I'll tell you a little bit about that a little bit later in my talk. But I've got a really important function to do today to dispel this first myth about pathology is all about dead bodies. And this is something I think probably most of the speakers tonight will have come across throughout their careers. I've encountered it as a result of talking to my friends, my family, and even other hospital doctors as well. So it's a really common myth. If we could go to the next slide. So why does this myth come from, and why do people think this? Well, some of you, if you've been watching TV, will recognize some of these characters from various different TV series. So in the top left, we have Dr. Quincy. In the bottom left, we have Dr. Derek Simpkins, who was a pathologist on A Touch of Frost. In the middle, we have Dr. Nikki Alexander, and before her, we had Dr. Sam Ryan, who heads up the forensic team as part of Silent Witness. And on the right-hand side, a more recent pathologist, we have Dr. Daniel Harrow as part of the series called Harrow. And what do they all have in common? Well, they are all forensic pathologists. And so you are exposed to a lot of forensic pathologists as a result of watching these various different TV shows. And as Susie mentioned, if you like reading about crime and crime novels as well, then you will encounter many of these similar characters as a result of that. Forensic pathologists have a really important role because if someone is murdered or dies by some form of misadventure or some form of accident, then they have the responsibility of trying to work out how and why they have died. So really important. But let's move to the next slide and see what the reality of the situation is. Well, the reality in pathology is that postmortems are only a very minor part of a pathologist's job, and it is only a small subset of the pathologists who actually undertake these. So as I mentioned, forensic pathologists, that's going to be their key aspect of their work. And the other group who undertake postmortems are in fact a group called histopathologists. But even this makes up a tiny percentage of their actual work. The vast majority of their work is to do with treating and diagnosing patients who are alive. And forensic pathology is a very, very small specialty, and there are many, many others, which I'm going to talk to you a little bit about in a few moments' time as well. And the important and key aspect of this is that pathologists use their expertise to support all aspects of healthcare. And around 95% of clinical pathways rely on a patient having involvement in a pathologist at some point along that journey, whether they're in the community as part of their GP practice or in the hospital setting as well. If we could go to the next slide. Now, I love the picture on the left-hand side. This is what is known as the tree of medicine, and it shows you how vital pathology is to all the different healthcare services that we have. And if you look at the branches of the tree, you can see all the different medical and surgical specialties that we have. So we have medical specialties such as neurology, where someone may have neurological abnormalities or problems. If someone has got a problem with their skin, they may attend a dermatology clinic. There also are departments focused on child health. And also, if you go in for an operation to have an organ removed, such as your appendix or your gallbladder. But all of these need pathology input. And as you can see from this picture, pathology represents the trunk, and all the different root system represent the different aspects of pathology. And without that sturdy trunk and that root system, it wouldn't keep the healthcare system in this country going. The other important thing to mention is that pathologists have a really important role of bringing all the jigsaw pieces together, and they can request a lot of different tests associated with the material that's sent to them. And they also work together closely amongst the other different pathology specialties as well. So it may be that some pathologists will look down the microscope at a piece of tissue that's been sent to them and look at the features of the cells. Others will look at the genetic aspects of the genetic aspects of a particular disease. And some can go into very very fine detail of the individual cells themselves. But the important thing is that we are bringing the jigsaw pieces together to make a diagnosis so that a patient can undergo the right management and the right treatment that they need in order to get better. If we can go to the next slide. So the other reality is that it isn't just about forensic pathology. There are a total of 17 different pathology specialties. Histopathologists are responsible for using either a microscope or a digital microscope to look at small samples of tissue or fluid that are sent to them from all over the different aspects of the body. And they using the microscope, they look at the features of the cells and their relationship to the other tissues to try and work out what the disease may be. And then they compose their report to send to the clinicians who are treating the patients. We also have hematologists that are responsible for looking at disorders related to the blood. And we also have chemical pathologists who are responsible for looking at different components of different body fluids, such as fat and glucose, to again help restore health to a patient. We also have microbiologists and virologists who are responsible for looking for different infectious causes, so things like bacteria, parasites, fungi, or viruses. And many of you will, of course, have heard of virologists in relation to the recent COVID-19 pandemic that we've been through. Then we have my specialty, which is neuropathology. So I'm very similar to a histopathologist, but I look at specimens that are taken from the brain, the spinal cord, the muscle, and the nerve, and look at those features using a microscope to make a diagnosis for my patients. We also, of course, love our pets, and we want to make sure that we can understand or help to make them better. And so we also have veterinary pathologists that are responsible for looking at the different causes of disease related to our animals as well. And also we have immunologists who are responsible for diagnosing different diseases or disorders related to the body's defense system. For example, if a patient has lots of allergies related to something, these are doctors and pathologists who can get involved in helping with their care. So there are a huge number of different specialties, and others include pediatric pathologists responsible for looking at diagnosing illnesses related to children. We have toxicologists, we have geneticists, and we also have those responsible for looking at reproductive medicine as well. We could go on to the next slide, please, Penny. So this myth, pathology is all about dead bodies. Hopefully I've been able to show you that, in fact, that is not the case. The majority of a pathologist's work is for the benefit of the living, and helping to make sure that our patients get the right diagnosis, and as a result of that, get the right treatment and management that they need. Thank you.
Thank you, Matt. A couple of questions for you. The first one is about what's it like working with dead bodies every day? Is it a difficult thing to do?
That's a very important question. Actually, it's not difficult. We have a very important role in trying to work out why someone may have died. So, if someone, perhaps a family member, has died very suddenly, we have a big responsibility in trying to work out for the family why that patient may have died. We have to pay a lot of respect, of course, to the deceased, and we have certain protocols and processes that we go through. But it's part of our practice, and of course, it may take a little bit of getting used to initially, but it then becomes part of our routine practice.
Great, thank you. The next question is about, would you say pathologists work in isolation? That's often what you see on the television, a bit of a loner who doesn't get on with people, or do they work in a team?
No, we're often thought to be sort of hidden away within the hospitals, but that's quite the opposite to the reality of the case. We work as a part of a huge team with the doctors on the wards, with radiologists who are responsible for looking at imaging studies, and also amongst ourselves as well. So we're frequently in contact and in meetings with our other pathology specialty colleagues, and also other junior doctors and other healthcare staff on the wards as well. So we have a huge network of people, and including scientists who work very closely with us in the labs as well. So we're not isolated on our own. We work with a huge number of different people in a team.
Thank you. It must be quite odd being a pathologist. You train as a doctor and you obviously go into medicine to help patients. But how much actual interaction with patients do you have?
So probably with very little interaction with patients, but what I always try to reassure myself is that every set of slides that I receive, that is a patient, and I have all the information on my computer screen about the patient, why they've come to the hospital. And so although I may not see the patient face to face, I feel that I've got a patient in front of me because I've got this really important material in front of me as well. But other pathology specialties have a bit more face-to-face contact. So for example, hematologists or chemical pathologists and even immunologists pathologists may interact with patients through clinics as well. So it varies according to what specialty you're part of.
I hope you enjoyed learning the facts behind that myth. You can see more of these videos on the Royal College of Pathologists YouTube channel at I Love Pathology.